Many men have no idea of the true potential of Tadalafil. They feel that the body tries to respond, but performance remains inconsistent. Firmness does not happen as expected, and frustration keeps coming back. Often, the problem is not in the medicine itself, but in the way it is being used. There is a correct way to take it, at the right time, with the right adjustment. And when that happens, the effect changes completely. The erection becomes firmer, lasts longer, and gains consistency. In this video, I am Dr. Elena Moretti, urologist, and I will show you what truly works in practice. If you are looking for real performance, the information starts now. Before we continue, check if you are already subscribed to the channel. Here, we focus on male intimate health with direct and clear guidance. And take a moment to interact. If you have already used Tadalafil and felt the result was below expectations, type the word weak. If it worked well and surprised you, type the word strong. This helps us understand the real experience of those who follow the channel. One of the most common mistakes is when someone takes Tadalafil and tries to begin the intimate moment right afterward. It may seem simple, but this impulse can compromise the effect of the medicine. Tadalafil needs time to be absorbed, circulate in the blood, and reach the vessels in the intimate region. This takes, on average, between 30 and 60 minutes. What happens is that many men do not give it this time. They take the pill and expect an immediate effect. But the body needs a process. Just as food is not digested in seconds, the medicine also needs to follow its path before acting effectively. I remember a patient who believed the medicine did not work. He would take it and already expect results within minutes. When he began to wait the necessary time, he realized the response was completely different. The problem was not the effectiveness of the medicine, but the rush. Tadalafil can offer good results, but only when used with attention. Patience is necessary for the body to do its part. If you rush too much, you end up blocking exactly the effect you are hoping for. Anxiety has a silent power to disturb everything, including the effect of Tadalafil. Many men take the medicine expecting an immediate and perfect result. But if the body is under tension, worried about performance, afraid of failure, or feeling insecure about the situation, the result can be very different from what was expected. The nervous system directly influences the sexual response. When the mind is under pressure, blood flow decreases, muscles do not relax, and the brain sends alert signals, exactly the opposite of what the medicine needs in order to work properly. A 61-year-old man told me that in the first attempts, nothing seemed to happen. He was nervous, with expectations that were too high, and this blocked everything. Only on the third or fourth try, when he felt more relaxed, did he start to notice consistent results. That is why insisting on just one attempt is not ideal. The body needs time to adapt, and in many cases, the problem is not in the substance, but in the emotional state. Tadalafil works better when the mind cooperates. For this reason, creating a more relaxed environment, without pressure, and understanding that the effect improves with time and confidence makes all the difference. There are two safe ways to use Tadalafil, with a daily dose or only before. Intimacy. Each one has specific advantages, and understanding that helps you choose what really makes sense for your routine. The daily dose of 5 milligrams is usually recommended for those who prefer spontaneity. By using it every day, the medicine maintains a stable concentration in the blood. This means you do not need to plan in advance. If the intimate moment arises, your body is already prepared. It is a great option for those who do not like to think about the exact timing of the dose. The 20 milligram dose, on the other hand, is used only on specific occasions. It should be taken at least 30 minutes in advance, and its effect can last up to 36 hours. This option is ideal for those who have a more predictable routine or prefer not to use medication frequently. However, this single-use version has a higher chance of causing effects such as headache, facial warmth, or discomfort in the back. The choice between one option or the other depends on your lifestyle and how sensitive you are to the medication. There is no right or wrong. What matters is what works best for you, with less discomfort and more peace of mind. If you are looking to improve your sexual response in a complete way, not only with the correct use of Tadalafil, but also through changes that affect desire, confidence, and relationship quality, I have prepared a material that can help. In my digital book, Rediscovering Intimacy, Healthy Sexuality, after the age of 60, you will find practical guidance to overcome physical and emotional blocks, strengthen your connection with your partner, and restore pleasure with more safety and natural ease. The link is in the first pinned comment. Take advantage of this material to take the next step with more clarity and consistency. When it comes to Tadalafil, choosing only based on the lowest price can affect the result. Even if many products contain the same active substance, the way they are manufactured and absorbed by the body can vary a lot. This directly affects the effectiveness and the consistency of the results. Some medications follow stricter quality standards, with controls on purity, formula stability, and better absorption. Others, sold at a very low cost, may have more variation in their composition, which interferes with how the body responds. One patient told me he had been using a cheaper tablet and was not noticing much improvement. After switching to a higher quality version, without changing the dose, he noticed a clear difference in firmness and response time. The best way is to start with a product that has a good reputation and is approved by serious regulatory authorities. Observing how your body reacts is essential. Only then should you consider other options if necessary. Intimate health deserves attention. Making careful choices is not a luxury, it is responsibility. When the product quality is high, results appear with more confidence and safety, and that makes all the difference. For those who want an active and satisfying sex life, the standard dose is not always the one that works best. Each body responds in its own way, and for that reason, many men end up developing small strategies to adjust the use of Tadalafil to their individual need. The most important thing is knowing how to do this safely. Some men take a low dose every day, and on special days, add a small extra portion to enhance the effect. Others prefer to divide the 20 milligram tablet in half, taking only one part before intimacy. There are also those who use it every other day, observing how the body responds. These adaptations can work well, as long as the maximum daily limit, which is 20 milligrams, is respected. Taking more than this amount can increase the risk of unwanted effects such as headache, acid reflux, or muscle discomfort. But small, controlled variations are often well tolerated. What is most interesting is that, over time, many men discover they need less than they thought. Simple adjustments, made with attention, can bring significant results. The secret is to observe your own body and maintain a consistent routine. When you find the ideal amount, the use becomes lighter, more effective, and much more satisfying. Men with chronic conditions such as high blood pressure, diabetes, high cholesterol, or a history of heart problems often wonder if they can use Tadalafil safely. The answer depends on how well their overall health is being managed. If the heart is stable, with medical supervision, and the person can perform light physical activities without shortness of breath or chest pain. In many cases, the use of Tadalafil is allowed. What should be avoided is taking the medication in situations where the physical effort of intimacy presents a real risk, such as in cases of serious arrhythmia or after a recent heart attack. Another important point is that Tadalafil should not be combined with medications that contain nitrates, which are used by some heart patients. This combination can cause a sudden drop in blood pressure. That's why, before starting, anyone living with chronic conditions should talk to a doctor, especially a cardiologist. In many cases, the medication will be approved with specific guidelines. The most important thing is to avoid self-medication. Even though it is well tolerated by most people, Tadalafil requires responsibility. When used safely, it can be a valuable ally, even for those with a more delicate health history. Many men consider stopping the use of Tadalafil after a while, and in some cases this can be possible. But what few people mention is that the quality of the erection after stopping the medication depends a lot on what was done during the period when the medication was helping. If the cause of erectile dysfunction is linked to factors like being overweight, poor eating habits, lack of physical activity, uncontrolled blood sugar, or smoking, and none of this is corrected, it is very likely that the problem will return soon after stopping. Tadalafil by itself does not treat the root cause. It improves the body's response, but without lifestyle changes, the effect is only temporary. I have seen cases of patients who were able to stop using it because they improved their overall health, but I also followed others who decided to stop and immediately noticed a clear decline. The ideal is to use the period while taking the medication as an opportunity to restructure, eat better, sleep well, move your body, and quit harmful habits. When that happens, the body tends to recover part of its natural function, and the medication can be reduced or even discontinued with more safety and without frustration. If you made it this far, you already understand that Tadalafil can bring excellent results. But everything depends on how it is used, your emotional readiness, and the choices you make every day. Using it in a hurry, ignoring the signals from your body, or not. Adjusting the dose properly are mistakes that cost a lot for those who seek real performance. Now tell me in the comments, have you ever tried adjusting the dose or timing of Tadalafil to see if the effect improves? I'd really like to know how you are managing this in practice. And if this content helped you, don't forget to like the video. That like tells YouTube this topic matters and helps other men find the same information they need. Take a look at the other videos on this channel. We go deeper into topics like erection, testosterone, and intimate health after the age of 60. There's a lot of practical content waiting for you. And of course, if you're not subscribed yet, this is the perfect time. Here you get direct, clear, and open guidance. I'll see you in the next video. Take care.